Hi everyone, I'm going to run you through a mock intake using your Physiomed Healthscore. And the purpose of this is to help us manage both consistency and efficacy, both right from the consult to the report of findings. And this is irrespective of who's conducting the intake in your office. When we were redesigning the Physiomed Healthscore, we wanted to facilitate several ends, including we wanted to ensure a standard of care. Obviously, we wanted to ensure, as aforementioned, an interdisciplinary consistency, and this was irrespective of both training and background, professional background. We wanted to be able to educate the patient on the breadth and depth of potential application within a Physiomed clinic, especially as it applies to both preventive and active care. We wanted to improve patient compliance and reinforce potential treatment plans and guide treatment plans, of course, and to increase patient satisfaction and brand consistency. So when we click here on time for a new HRA, when we're in the patient's intake, this is essentially where we begin the consult. Now, we're assuming that the patient is sitting here. It will be a mock patient, Jane PM. We will call her. A lot of this data will have been auto-generated through Coligo. So let's begin. Hi Jane, my name is Dr. Alice. Welcome to Physiomed. How can we help? Or we can say, what brings you to the clinic today? Now answers can range, can be numerous. It can be for, but principal reason for consulting with this clinic. Let's say it's in this situation, low back pain. And we want to tease this out a little bit and ask her, is there anything else that you would like to discuss today, or is there anything else bothering you? She might answer, yep, I get the occasional tension headaches and health goals, weight loss, and there might be some digestive concerns as well in this particular mock patient. Great, so then we're going to explain the process after establishing, we're going to explain the process, and Jane, I will be asking you a series of questions, some of which may be directly relevant to your chief concerns, some may not, but they're all relevant to your health. And it's important that we establish this fact. I will also be taking your vitals and conducting a movement screen. All results will be accurately tracked and scored along continuum from high risk to optimal. You will have full access to these results. Now, after the case history and biometric screen, we're also going to be conducting a thorough examination. Now, the person that's conducting this consult may not be conducting the examination. It may be the DC or the PT, but the idea is that by conducting the examination, we're going to further isolate the cause of their concern. Now, Jane, x-rays may also be taken today depending on what we find during this examination. All results will be explained to you prior to any treatments being provided. Sounds good? Okay, so then we can move on. And we certainly want to assure the patient and reinforce and establish confidence, and that's why we're going to outline exactly what's going to happen during this visit. We want to use language such as, Jane, I'm glad you're here. We will do everything possible to address your concerns. So, let's begin. Tell me a little bit about yourself. Are you married? Single, common law, and again, you will find this out. So let's assume that Jane is living common law. Number of children she has is 1. Birth date is 2014. Today, the child is 10 years old, born in 1994. So we're going to add that. And we're going to scroll down. Jane, are you taking any supplements right now? Natural supplements, vitamins, minerals, etc.? Yes, she's taking a multivitamin. And you want to ask the quality of that multivitamin. She may or may not know. She may say that it's from GNC, but we'll just make a note of that, GNC. And how much do you take? She may say 1 per day, or as I remember it. So let's just assume it's as every so often. Jane, are you presently taking any medications? And she's going to say, we'll say yes, Advil for back pain, and occasional headaches. And for back pain, Advil, we know will be over the counter. Great. So Jane, I'm going to ask you now some questions about your family's health history. What sort of diseases run in the family? I want you to think about your mom's side, your dad's side, including aunts and uncles, etc. And she's going to say that thyroid is on her mom's side, that there was some heart disease on her dad's side of the family, and there is some arthritis or chronic pain on both sides of the family. Okay. We're going to hit save, and we're going to move on. And we can see the profile family health history has been completed. We move on to disease history. Jane, any issues with eyes and vision? And again, this is really just meant to establish a review of systems. This was a very easy way to do it, where I can ask eyes and visions, ears, nose and throat, heart and cardiovascular, general respiratory, gastrointestinal, we're going to say yes. Genitourinary history, let's say if she goes, yes, I had a history of UTIs, musculoskeletal as aforementioned, and some past history of acne, etc. And anything else that we want to add in this in terms of the review of system, we can do here under 13. We're going to move forward. Jane, I'm going to ask you a little bit about the pain that you're experiencing both presently and in the past. Now, she mentioned that there's a history of tension headaches, but this again will be a general review of system in terms of pain. Tension headaches, both past and in the present. No history of migraines. Shoulder pain in the past on the left. Low back pain presently. No history of hip pain, no history of sciatica, knee pain, foot pain in the past, and we will hit next. I want you to rate, when you have a tension headache, Jane, would you characterize it as mild, moderate, or severe? And she will say moderate. It's pretty bad, but I can kind of live with it. And the low back pain that she's presently experiencing, let's just say it also is moderate. Jane, are you currently or have you ever been a daily cigarette smoker? She's going to say never. And we will move on to physical activity. Now this section was in particular tweaked in order to facilitate and address and highlight, if you will, the need for active care. So Jane, are you presently exercising regularly or involved in a physically demanding job? No. When did you feel you were most satisfied with your physical condition? And have the patient reflect on this. And most of these, from questions 2 to 6 will, or 2 to 5 will definitely be reflective. Give them time to think about it, but don't overstay. If we need to move on, please do move on. So when did you feel you were most satisfied with your physical condition? In college. Why? Increased vitality, lots of energy, felt good about myself. How did you feel? Felt great, vital. How did you look? £25 lighter. Whatever whatever their expression, just try to capture this description in their own words. This will definitely get them feeling about the potential that they may have in achieving, again, their optimal health. In your opinion, what is your ideal body weight? 125 pounds. What is your current weight? 156 pounds. Jane, have you ever failed to stick to an exercise program in the past? Yes. If yes, why? Lack of guidance and accountability. On a scale of 1 to 10, in your opinion, what is your fitness knowledge? 6. We will now move on to this will then ask her the stage of change question. How do you feel about getting more exercise? And I am ready to change. So let's assume that she is sort of moving towards wanting to improve her health, and she's taking the steps to come to our clinics. Jane, I'm going to ask you some questions about your nutrition habits. How many servings of vegetables do you eat every day? One handful is a serving. 1 to 2. How many whole raw fruits do you eat per day? About 1 to 2 servings. Healthy fats. Once in a while. Do you eat fish at least 2 times per week, or regularly supplement with fish oil? No. And again, this question alone is very easy to, again, facilitate the need for using fish oil, especially high EPA variations, in order to down-regulate inflammation. And it helps address the need for that. How many of your meals contain a good source of high-quality protein, such as organic chicken or meat, fish, tofu, lentils, etc.? About half my meals. Less than half my meals and about half the meals. Again, you want to be thinking in terms of potential protein supplementation, whether that is a hydrolyzed collagen or a hydrolyzed rice or pea variation. About half my meals. How often do you eat a good source of fiber, such as all bran cereal, whole grains, oats, quinoa, barley, lentils, etc.? Almost never. How often do you eat white starches? Once in a while. Sweets, snacks, or fast food? Again, once in a while. Coffee, cola, 3 or 4. How much plain water do you consume in a typical day? 1 to 2 large glasses. How would you describe your feelings about improving your diet? I've thought about making some changes, just not now. Haven't even thought about it. I plan on making, or I've recently made some improvements to my diet, which we can see with the some increased vegetables, some increase in protein, etc. On a scale of 1 to 10, in your opinion, what is your nutritional knowledge? And she'll say 5. Have you ever followed a weight loss or nutritional program before? If they have, say yes, and they may say Weight Watchers or some other commercial program. Ask them about their success with it. Next. How many alcoholic drinks would you typically, or would you consume in a typical week? If there is 14 or more, cage questions will be asked. But let's just assume that Jane will drink 4 to 7 or 0 to 3 drinks. Not a heavy drinker, a very light drinker. The next questions I'm going to ask you are about your mental well-being. How have you been feeling in general during the past month? Up and down. How often were you bothered by any illness, bodily disorder, aches, or pains during the past month? As we know that these will relate directly to depression risk. Almost every day. Did you feel depressed during the past month? Yes, a little now and then. Have you been anxious or upset during the past month? A little bit. How much energy did you have during the past month? Again, great to assess their actual level of energy and being able to differentiate whether it's a fatigue as it relates to a primary cause, anemia, etc., or whether it is related to lifestyle. Energy, very low energy, or generally low energy or PEP. How happy, satisfied, or pleased have you been with your personal life during the past month? Sometimes fairly happy. I woke up feeling fresh and rested during the past month. Some of the time, all the time, a little bit, none of the time. We'll say a little of the time. Next. Now we're going to move to a general stress questions. How often have you felt stressed or under pressure? We'll say fairly often. How often you felt confident about your ability to handle your personal problems? Fairly often. In the last month, how often you felt overwhelmed as a result of the stress in your life? Sometimes. How much work-related stress do you have? We'll say 7. How much financial stress? 6. Child-related stress, 10 years old. 4. Marital stress or relationship stress. Say an 8. Health-related stress, also an 8. How do you feel stress is impacting your life? This is a great question. And having the patient really contemplate this is, on many levels can be a game changer as they begin to see how stress, in fact, may be impacting their, and they may come to the conclusion or maybe guided that maybe it's um, decreasing ability to exercise, impacting pain. Maybe it's causing them to eat emotionally, causing me to eat emotionally, etc., etc. Do you have any health problems or symptoms you feel may be related to the stress in your life? Tension headaches seem to be exacerbated by the stress. And what do you do for stress relief? I like to read, watch movies. Maybe she likes to walk her dog. Walk dog. Great. Now we will move to the biometrics. Jane, I'm going to get you to come on over here. I'm going to get you to stand on the scale. We're going to take a quick height reading. So we find that Jane is 63 inches or 5'3". Weight is pretty close to what she thought, 158 pounds. Hip circumference is at the fattest part of the belly. We're just wrapping our tape measure around, and it is 35 inches. Anything over 34 inches, typically in a female, will come with some increased metabolic risk. Hip, 41 inches. You'll see that when height and weight were entered, body mass index is automatically calculated. Lean body mass, we're going to get you to hold on to this our body composition monitor here, and we're going to find that you're 105 pounds of lean muscle. Again, if your body composition analyzer doesn't do that, then just use the body percentage fat. That will be enough to generate your health score. Percent body fat, we said, was 31%. Systolic blood pressure, 124 over 84. Next, we're going to move on to over to the clinical functional fitness screen, and everything is going to be graded in this from forward bend to TVA contraction from 0 to 3. 0 is a failing score due to pain provoked during the test, or poor. 1 is fair, 2 is good, 3 is excellent. Fair is, or 1 would be a failing score, significant limitation, or asymmetry. 2 would be a passing score, minor limitation. This would be a good score. And 3 would be a perfect test with no visible limitation. These are as outlined by Dr. Lemieux. And again, 0 to 3 is the easiest way for us to do a gross assessment of the CFFS. Okay, so she does a forward bend. There is some pain due to the back pain, so she gets a score of 0. Overhead squat, again, significant limitation or asymmetry. Actually, we're going to say 0 again because of pain. Single leg stand, she's able to do marginally on one side, not the other. Shoulder external rotation, passing score, minor limitation, and TVA contraction, again, caused pain. So a score of 0. Great. So we're going to submit that, and again we come directly to the health score results. And Jane, we can see here everything is scored from high risk red to optimal being green. You will have access to all of these results. And again, we can see that things are color coded on the side: body composition, mental health, stress, nutrition, and physical activity. Anything that is orange or red is considered moderate to high risk. This allows us to make a note whether the patient would like to improve this score. If we hit print here, it will generate for you a output of their feedback, which we will then be able to include in their report of findings. So again, smoking, physical activity, nutrition, moderate high risk. Alcohol score is green, or optimal mental health, moderate high risk, also for stress, body composition, including blood pressure, also metabolic score, and the clinical fitness functional score, or the CFS. And again, all of these, in terms of these hard biometrics, blood pressure, metabolic, etc., all of these will be tracked and measured. So as you do progress exams, you will see a change, an actual percentage change, and it will be graphed here of their improvement or not as we go through these scores. And that's it. From here, we will move on to the regional and or radiographic examination and the patient report of findings.